1230 WDBZ, the buzz of Cincinnati, your talk station, the Lincoln Ware Show, till 1 o'clock this afternoon. And let's go to my good friend, urologist Dr. Kappa from the Urology Group. Dr. Kappa, what's going on?
Oh, Lincoln, it's great to be on again with you. I appreciate this opportunity always. I know you're really passionate about men's health and cancer screening, particularly prostate cancer screening. As you know, and you shared earlier, we had some big news and very unfortunate news this weekend with former President Biden.
Yeah, and some stuff I heard around that, they say, like, when I just turned 75, and they say at 75, they don't even give you the PSA anymore. There's no need to take it anymore. If you have cancer, that's just it. I don't know. So fill us in on that.
Yeah, well, I think it's important just to kind of start with, everybody's interested and, sympathetic towards the former president because he got a really difficult diagnosis. So just the facts about his case, I think it'll help answer your question and help your listeners better understand about what they need to do for their own health. And so his personal office on Sunday was a big news story, released that he was diagnosed with an aggressive metastatic form of prostate cancer. And basically what that means is it's spread outside the prostate. In his case, it was the bone. And he didn't really know about this because he presented with urinary symptoms that led to an exam. They found a prostate nodule, a biopsy, and then likely imaging that allowed his team to share with the public that it had spread to his bone. So it's a really difficult diagnosis. You think of this as stage 4 cancer. Most prostate cancer, actually, of all the men who are diagnosed with prostate cancer, only 3% will die from their disease. But when you talk about stage 4 cancer, the 5-year survival numbers go down to 37%. So it's a really difficult diagnosis. Obviously, we're thinking about the president, his former president, his family, as they deal with this really difficult news. And your point about PSA screening is right on. What do we do? Like, what can the men listening to this program do to get screened, to get checked? The first thing I'd emphasize, and President Biden's story really highlights this, if you have symptoms, don't ignore those. A lot of guys will get symptoms, urinary symptoms, trouble peeing, blood in their urine, pain, they kind of ignore it. This is really a wake-up call for guys to get checked. I like to kind of think of this as, you're more likely to get diagnosed with prostate cancer in your lifetime, 1 in 8 men overall, 1 in 6 black men, than you are for your car to break down this year. And everybody gets their car checked, their oil changed, their tires rotated. People spend more time getting their car maintenance than they do getting their own health checks. So that's just it's a wake-up call for all of us to go to your doctor, have that conversation, get your blood tests that you need, and decide what's best for you.
Man, I tell you. And so if you're one of these guys that wake up 2 or 3 times during the night, does that mean you have an enlarged prostate?
Yeah, absolutely. That's a great point. So you have symptoms. I mentioned blood in your urine, difficulty with urinating. Let's kind of start with, not cancer per se, but the most common form of prostate problems that we see is just an enlarged prostate. So you mentioned waking up 2 or 3 times. It could be normal to wake up a couple times as you get older, but if you're waking up 4 or 5 times a night, that is most likely the sign of an enlarged prostate, and you definitely need to get checked. And the good news is there is very good treatment available, both medication and surgeries, which we can talk about if you'd like.
Now, we got a caller that has a question for you. Dr. E, you have a question for Dr. Kappa.
No, what I want to do is first thank you, Lincoln, because the last time Dr. Kappa was on the show, I listened to him, and I was impressed. So guess what, man? Yesterday I went to visit him.
Oh, okay.
And I was really pleased with my meeting, and he's very professional, he's very sensitive, and he's very conscious, Lincoln. I raise some issues. Anytime I go to a doctor, I'm going to raise something about blackness and black men.
Yes.
And I really liked what he shared. One of the problems we have is the fact that in the tri-state, there are no black urologists. He's the 4th one I've had. And Dr. Kappa, I appreciate you all got back to me this morning. And Lincoln, I don't have any problem. This is just to give you something if he wants to share a person like me. Okay, I had a 4.7, Lincoln.
Ooh, that's not good. That's not really good for a black man, 4.7.
Well, wait a minute. Like PSA. So he can go from there and share, if he wants, what our conversation was. So thank you, Dr. Kappa.
All right.
Wow, yeah.
Okay, go ahead.
Wasn't expected that. I appreciate one of my patients. Yeah, I got to be careful with just patient privacy. I appreciate the him sharing, but you know what? I can speak generally to this comment. It's a really important one. Okay, so you come in, you get checked. You know, one thing I want to just pivot to real quick is barriers to screening. He was kind of mentioning that. You know, having some fear associated with this test, having not the right information out in the public, just a hesitancy to come in. And, I appreciate the call and the example. Hey, I came in, I got checked, we have this blood test, we're going to go from there. And I just emphasize that every single appointment that we have, we individualize, we personalize that discussion and say, here's what we can do. Here are the tests. You mentioned the PSA blood test. If that's high, it doesn't mean we go straight to a biopsy. It means we can do other tests. And there's actually a brand new test that was just some research that was just shared using your saliva to help better understand your risk for prostate cancer. So we do a whole bunch of things.
Are you doing that? Are you doing that saliva test over there at the urology group now? You doing that now?
Okay. Oh yeah, no. This is just hot off the presses. The New England Journal of Medicine. Yeah. This is a really premier journal that we read. Just published a study out of the United Kingdom. Our friends over the pond, and they looked at men and their prostate cancer risk. And sort of the bottom line is they employed not just the PSA screening, which is typical, or MRI, which is typical, but a saliva test to identify your individual genetic risk. And from there, what they were basically able to do with the highest risk men on this saliva test to identify men that could have been missed with regular screening. And the reason I want to share that study and the hope going forward is we're getting better and better every day at using less invasive tests to help men understand their risk of prostate cancer, to get the biopsy if it's appropriate for them, and then to get treatments, many of which are very well tolerated for patients. And so I want to just emphasize to your listener and to the caller and everyone else, have that discussion. Come in, talk to your doctor, go through that process. It can be life-saving.
Now, Dr. Eve just called. He gave us his PSA number. I think he said 4.7, did he say? But is that kind of high for a black man? I've known some black men with the 3 that had cancer.
Yeah, no, your point's really important. So the number allows us to understand your risk. But like you mentioned, we adjust it for high-risk groups. If you've had a family history of prostate cancer, if you're a black man, again, your risk of prostate cancer in your lifetime is 1 in 6. That's a lot, and it's 1 in 8 for all men. So all men should get screened. But for black men in particular, we adjust their risk based on those factors. And so, the PSA is not the only test. We do the exam, we do some imaging, and that's how these scenarios normally play out. We have that discussion, we talk about the biopsy. Age is a big factor too, and that's really an unfortunate part of former President Biden's case. He was 82, and I just read today that he actually hadn't had a PSA test since 2014. And the craziest part about that is that's actually that's the recommendation for men. After a certain age, and I just was reading a story today. My former chairman down at Vanderbilt, Dr. Penson, he was quoted in the Wall Street Journal today and said, the math is changing. We have such good tools now. We mentioned this saliva test that we can do better for men like former President Biden, catch disease earlier, individualize that treatment. And so this discussion, this diagnosis is really, I said, caused us to reflect on what the right screen is for men. And I think I would just emphasize those treatment decisions are individualized. We have guidelines that help us. But, if you're a fit, active guy in your 70s and you have a longer life expectancy, we want to make sure you get the appropriate prostate cancer screening too.
Now, what happens if they have to take your prostate out? Will that be the end of your sex life and all kind of stuff? What happens when they take your prostate out?
Yeah, no, you're kind of jumping right to the treatment. So, if you do have intermediate or higher risk form of disease, one of the treatments is prostate surgery, prostate removal. We do that robotically, which involves some small incisions, removal of the prostate, and typically the lymph nodes as well. You mentioned the side effects. Oh, definitely. I don't like to sugarcoat that for patients. There are certainly urinary and sexual side effects, but I would also emphasize we're much, much better in terms of our surgical techniques. sparing the nerves, sparing the blood vessels where we can, and also with our rehab programs for both urinary and sexual health. So, it's not the end. I wouldn't say that at all. It's definitely, anytime you do major surgery on any patient, your life is different after surgery. There's no sugarcoating that. But I would just say, we have a lot of guys who go through this, and we're really sensitive to that part. It's an important part of their life for men. We get that. We're really passionate about that, too. So we have a whole rehab program set up that focuses on urinary and sexual health issues for men who are getting prostate cancer treatment, if that's radiation, if that's surgery. We really put an emphasis on that throughout the treatment course.
All right, we got another caller with a question. Joan, you have a question for
Yes,
Dr.
I would like
Kappa.
to ask the doctor. I know they say about you have to look at those PSA levels if they're above 4. Well, let me ask you this. My husband has had high PSAs for years. I mean, years. And he's had biopsies. He's even had MRI. And every time he's had a high PSA or a biopsy, we come back to the doctor. He examines it, the other way. And it's nothing but he has an enlarged prostate. But he has never been diagnosed with cancer. So can you explain to me why?
Yeah, no, that's a great question. I'll say just a caveat, not knowing the whole details, all the details of that case. We do see that a lot, too, where men have just a very enlarged prostate, and so their PSA will be higher than a man with a normal-sized prostate. We use this calculation called PSA density, and so that helps us better understand a man's risk and also reassure them after a biopsy that's negative for cancer, we celebrate that. After an MRI that's negative for cancer, we celebrate that. You can have a higher PSA, and it can be normal for you. And then we really focus our treatment, shift our treatment to the urinary defects and struggles that men will have with larger prostates.
Now, why does your prostate get large? I mean, what makes it get enlarged? Or can you do anything to make that not happen?
Well, I like to say normal male aging. All men pretty much will experience enlarged prostate. It's 43 million men in America have a formal diagnosis of BPH. That's the enlarged prostate. So it's a really common problem, and that probably underestimates it. So there are some certainly hormonal factors and genetic factors, but really it's a normal part of aging. And so we tell guys, you're going to experience some different urinary symptoms as you get older. Don't ignore them, because we have really effective treatments. Again, a new procedure that our group has partnered with the Radiology Associates of Northern Kentucky, Dr. Van Young and his team. It's called prostatic arterial embolization, PAE. We have a brand new center that treats men who don't have prostate cancer. I don't want to confuse that. That's a whole different treatment, but a minimally invasive procedure to shrink the prostate. We've had some really good success for that. So I just wanted to emphasize that as one of many treatment options that we offer men who have that enlarged prostate.
All right. Now, does how often you have sex have to do with your prostate getting enlarged or not? That has nothing to do with it. I've heard rumors of that. They say if you don't have much sex, your prostate is going to get enlarged. If you have a lot of sex, it'll stay small. Is that?
I don't. How do you want me to answer that? No, yeah. Well, actually, on a serious point, actually, we have looked at that frequency of sexual activity and prostate cancer risk. And, your listeners will be happy to know that the more frequently you have sexual intercourse, the lower your risk of prostate cancer is. So not as much, so that they can remember that one. But what I would say is prostate size, not as much as far as I'm aware. But,
yes.
We encourage men, we're really passionate about prostate cancer screening, urinary health, sexual health. And so these are all discussions, again, just another reason to come in. Don't be shy about that. We haven't talked yet. I'm sure you might get to it a little bit about erectile dysfunction. This is a super common problem. These affect most men in their life. Enlarged prostates, again, the 1 in 8 men who get prostate cancer in their life, erectile dysfunction is very common. And here's the good news for men is we have really good screening programs. We have really good treatments, non-invasive treatments, non-invasive ways to evaluate these problems and treat these problems successfully.
Now, since you hear all the commercials on the low T and testosterone, are you getting a lot of patients in there wanting that testosterone?
Oh, yeah. So that's a whole other topic. So, again, kind of under the umbrella of men's sexual health, low T or testosterone. And, it's actually really common. And a lot of men who come in who have erectile dysfunction, I always recommend to them, let's check a baseline testosterone level. I also say, just before getting into that treatment discussion, is, there's a lot of things guys can do on their own to prevent some of these problems. You mentioned the prostate. It's normal to enlarge with aging, but nutrition is key for prostate cancer prevention. A good, healthy diet, plant-based, getting your fruits and vegetables. It's everything we were told growing up. It is true with prostate cancer prevention, too. But for men's sexual health and testosterone level, here are the basics. Getting a good night's rest. Sleep is key. Exercise, including strength training and just walking, cardiovascular fitness. Nutrition, I mentioned already. A healthy diet, making sure you get your fruits and vegetables. Avoiding the junk. Avoiding smoking, excess alcohol use. Having healthy relationships in your life. Those are kind of the big five that I say ultimately relate to your urinary and sexual health and your testosterone as well. So there are things guys can do before getting testosterone treatment that can naturally raise their testosterone, actually.
And what's a average level you should have for testosterone?
Yeah, like the PSA, it depends on age. We actually have a table that I'll show guys, a study that shows, what should your testosterone be based on your age. The rough number that we use is less than 300 with 2 different lab tests in the morning. We consider to be low testosterone or testosterone deficiency. And, then we talk to men about the risks and the benefits of treatment. We're really conservative in our approach. I tell guys we can't, turn you into Hercules overnight. What we want to do, you're not going to be 20. I say, you're not going to be 20 years old again with testosterone. We want you to feel good and be active and do things you enjoy. Go hiking, go golfing, whatever your hobbies are. And those are things that are important to us, too, quality of life concerns. But we treat men and get them to the appropriate level. And, and men who have a low testosterone don't know about it. When they get treated, they do feel a lot better. And we emphasize, too, and I know you're passionate about this, Lincoln, the importance of prostate cancer screening. So we look at everything. You focus on this one problem, but we also, while guys are there, we'll check their PSA, we'll do their exam. That's a really important part of every visit we do.
All right, Dr. Kappa, we got to get you back again next month. We want to get you in here once a month anyway and bring us up to date.
Oh, I would love that. I appreciate this opportunity. And, again, with the news of former President Biden, obviously, we're thinking about him. But it's a wake-up call to guys. Go talk to your doctor. Get your PSA checked. Don't hesitate. Do it right now.
All right, Dr. Kappa from the Urology Group, thank you for talking. Appreciate it.
Yeah, I appreciate it, Lincoln. I'll see you next month.
All right, that's Dr. Kappa right there.